So the first components I want to talk about is hypoxia. So what is hypoxia? Hypoxia is essentially where the tissue of the body is not getting enough oxygen, okay? Hypoxia is low levels of tissue oxygenation. And there's no such thing as, okay, let's put it this way. If you have complete hypoxia for 3 minutes, you're dead. For most people, 2 minutes of hypoxia, you're dead. What I mean is 100% hypoxia. So hypoxia is low levels of oxygen, but if you have no oxygen, I guess the correct term instead of hypoxia, hypo meaning low, oxia, if you say anoxia or no oxygen, you're dead. Hypoxia chronically can lead to severe metabolic problems, health problems, and such. So cancer, for example, is a chronic hypoxic state, and cancer cells are anaerobic metabolizers. They're obligate anaerobic metabolizers, which means obligate means they have an obligation to, they can't do anything else, and anaerobic means without oxygen. They need an oxygen-free environment to continue to survive. So if we can put oxygen into the tissue, especially things that are causing, where there's a cancer issue, you don't have to worry so much about the cancer anymore, because the oxygen in the tissue creates an environment that is now non-conducive to the cancer, meaning that cancer does not like an oxygen-rich environment, okay? That's an example. Heart disease, another issue, where the body is not able to perfuse the tissue to optimum levels of oxygenation, because the heart is either compromised, it's not pumping as well because of a cardiomyopathy, or an ejection fraction issue, or it could be something where there's a blockage of vascularity. So the blockage is causing the inability of the body to perfuse the blood, which carries oxygen, remember, to the rest of the tissue, so the oxygenation level of the blood is lower, thus reducing the level of oxygenation of the tissue, because there's not enough oxygen binding to the blood as it's being pumped through the body. So there's many different pathologies that can contribute to that, but I'm including that all-inclusive in heart disease. Whether it's a circulation issue, whether it's a heart pump issue where the heart's not pumping appropriately, a congestive heart failure issue, whatever the case may be. So heart disease and cancer represent 80% of all causes of death, which includes natural disasters, it includes wars, it includes homicide, suicide, motor vehicle accidents, any type of accidental death, any other disease process. You combine them all together, they only represent 20% of causes of death. 80% are caused by heart disease or cancer worldwide, okay, in the industrialized world. Now, if you add neurological injuries to that, then it goes into 92% of causes of death, or 9.2 out of every 10 people, I should say. 92% or 9.2 out of every 10 people are dying from either heart disease, cancer, or neurological issues. And the neurological issues are also a hypoxic issue, okay? So it's basically the lack of oxygen getting to our bodies. In fact, if you look at this COVID-19 issue, when they were talking about the presentation in New York, for example, the doctors that were censored there, they also described this, that this was not a typical viral component. This did not present itself like a virus. They didn't understand what was going on, but they said it appeared to be an altitude type sickness. They described it to be a hypoxic type injury, meaning that the body wasn't getting enough oxygen. Now, this, what I'm talking about, has no relationship to COVID, except that I'm just making the observational component that hypoxia is a very big problem. It's actually what COVID showed, but COVID, we know, is not a big issue because we're overinflated. I mean, I've said this many times, so it's nothing new. The numbers have been artificially inflated. Everything got shut down. It's been pretty widely now known. More and more people are recognizing. I think the statistics are more than 50% of the world knows that COVID was completely overblown. The cause of death is actually, the incidence of death from COVID is actually less than that of seasonal flu. And they had to even artificially inflate the numbers and create misinformation to even get the numbers up to the same level as seasonal flu as far as numbers of death. So the only reason I'm bringing this up is that hypoxia is a problem, and has been a problem with all diseases, all chronic disease. As we get older and our lungs are not expanding to the same level, we decrease our respiratory reserve, we lose capacity in our lungs, and that also contributes to being hypoxic. Person that becomes obese, for example, they don't exercise enough when they're walking uphill or they're walking up steps, they get short of breath. Okay, they're becoming hypoxic because their body needs more oxygen. So hypoxia is a common thing that people experience when you go into the hospital, you're having chest pain, you're short of breath. They'll put the nasal cannula on, which is a little tube with the two little prongs that go in your nose to go in your nose so that you can breathe oxygen in. That's to deal with the hypoxia, to give you 100% oxygen. So when you're walking and talking and moving around in your social circles, you're breathing in ambient air, and ambient air has 21% oxygen. It actually used to be 21%. It's probably now somewhere between 20 and 21%. It's actually reduced over the last 20, 30 years, the amount of oxygen in ambient air. So normally when you're breathing, about 1/5 of what you're breathing in is actually oxygen. The rest of it is other types of gases and such. So if we can increase the amount of oxygen that we're bringing into our bodies, we reduce the amount of potential for hypoxia, and thus we improve our state of health. All right. Now, why is this something that I'm talking about today of all days? Well, I'm going to tell you two reasons. First of all, in critical care medicine, in trauma medicine, in advanced cardiac life support medicine, which is a course that all doctors and nurses have to take, and I was an instructor for advanced cardiac life support. It's through the American College of Cardiology to teach doctors and nurses how to deal with heart attacks and other types of emergent issues to deal with circulation in the heart. All right. Pediatric advanced life support is a course that's similar, but it's for pediatrics, for children. It's a course for doctors to teach doctors and nurses how to deal with children that may be coming into the emergency room or that may end up having a life-threatening emergency, and how to deal with that. That stands for Pediatric Advanced Life Support. And then ATLS is Advanced Trauma Life Support, and that's through the American College of Surgeons. So that course is actually designed for doctors. Nurses can't take that course, but in the military they also teach that in combination with the Combat Casualty Care course to teach doctors how to deal with trauma. Blunt trauma like car accidents or falling off a building, or penetrating trauma like knifing or gunshot wounds, that type of stuff. Now, I was an instructor with the American College of Surgeons teaching advanced trauma life support for almost 20 years. I was an instructor with the American College of Cardiology and teaching the advanced cardiac life support course for about 17, 18 years, and also the pediatric advanced life support course. I taught that for about the same number of years, about 17, 18 years. These are all courses for doctors and nurses, and all to do with emergencies. Now, whether you're learning pediatric advanced life support, advanced cardiac life support, or advanced trauma life support, they all go back to the basics, what they call the A, the B, and the C's. ABCs are when you forget, or you don't remember, or you can't remember. It's like, wait a second, what am I supposed to do? How do I identify a cardiac tamponade versus a tension pneumothorax, because both can kill a person within a few minutes? What am I supposed to do? How do I diagnose it? When you lose your mind, when you can't remember what you're supposed to do, you go back to the basics. That's what we teach doctors, is that when you can't remember, go back to the basics. And what are the basics? Air, B, C. A is airway, B is breathing, C is circulation. So A, B, C. Go back to the ABCs. Airway is to open up the airway so that you can get oxygen. B, breathing. Make sure the lungs are able to expand. There's not, trauma. There's not blunt trauma to the chest or say a tension pneumothorax or something. So making sure that they're able to ventilate. So B, breathing. And C, circulation, to make sure the blood's circulating. Now, if you look at A, B, and C, airway, breathing, and circulation, they all come back to the issue of oxygenation in the body, and they're all addressing the need of the body to prevent the body from being in a state of hypoxia. It's all designed to prevent hypoxia. Hypoxia, again, as I said originally, if you are in a state of hypoxia, or anoxia, I should say, no oxygen for 2 to 3 minutes, you're dead. And hypoxia, or low levels of oxygen, can cause a lot of problems, including heart attack, stroke, and other types of issues. And on a chronic level, when we look at certain pathologies, like we look at diabetes, we look at people with cancer, We look at people with other types of issues such as, say, emphysema or chronic obstructive pulmonary disease or those type of issues. All these people are suffering from chronic hypoxia, and you end up having issues with tissue perfusion. It's low levels of oxygen, and if we can change that, if we can eradicate that and flip it so that the tissue in the body is able to oxygenate, things rapidly change. All right.